we're in a capitalistic country, so everything is catered to the people who are the most ignorant because they can sell the most to that person. So the client that has no medical knowledge, they're going to make it seem very easy, simple, quick, because then they can get more money out of them.
From a criminal perspective, is that he had a legal duty to supervise medical care, and he failed in that duty in a way that led to death. So again, talking about the standards, you've talked about the standard of a medical provider, a physician before, and the liability that he didn't hold up his side of the bargain. In Texas, he could face murder or manslaughter charges because his actions were reckless and they caused death.
You do not have to be a physician or even a medical personnel to actually open up a med spa. And that's where it gets a little tricky and a little concerning at who's able to open up a med spa. The issue with the med spas taking it a step further is that they are giving it to everyone and anyone, whether they need it or not. They spout and say that it's going to give you energy, it's going to make you feel younger, it's going to make you feel healthier. But that's not always the case. Medicine,
law, friendship. This is Dr. Long and Lawyer Nik. You're listening to the Medico-Legal Brief.
One doctor, one lawyer, and a whole lot of gray area.
Welcome back to the Medico-Legal Brief, where medicine meets the law. I got Dr. Long here. I'm Lawyer Nik. And Dr. Long, I have a very, very interesting situation today. I wanted to get your opinion on it. I think you are the best person to ask for this type of information. And it revolves around the med spa craze. Do you have any opinions on med spas and what they do and the type of patients they see and the clientele in your world?
Right now, med spas are controversial. They're like nail salons. You're seeing them pop up at every single corner, at every intersection. But the controversy actually lies behind who can open one. Every state is a little different. At the end of the day, you do not have to be a physician or even a medical personnel to actually open up a med spa. And that's who's able to open up a med spa. But the other thing to talk about is what does a med spa offer? Med spa typically offers things that are not covered by insurance. So it's going to be things that are not within the normal protocol for medications or healthcare or advancements in health in terms of traditional medicine. It's going to be things that are newer, things that are going to be still waiting for some data to support it. It's going to be things like peptides, hormones, off-label use of certain medications. Even GLP-1s can be siphoned through a med spa. Other things that you hear about are IV hydration or IV medications that you can get in these med spas. They're all trying to sell this idea that you're getting these medications to better enhance your life in one way or another.
I like that you brought up the IV because the IV is the central point of the situation I'm going to bring up today. From my understanding, it seems like the med spa starts where you have your traditional day spa, and it might be massages, and it might be steam rooms, and just what you think of a general spa. You have your medical clinic where I'm actually going in and seeing you, my doctor, and getting treatment for whatever my ailment is. But the med spa is kind of falling right in the middle, where it's that gray area of bringing some of the medicine in, but also bringing some of the day spa-esque relaxation techniques, the day spa-esque situations in which you can get massages, but you can also get Botox and so on and so forth. I've never been to a med spa, but at least here in Texas, like you said, they're on every street corner now.
Yeah, and med spas typically are cash pay. It's not something that goes through insurance. It's something that people who are privileged to be able to go into these med spas are the ones that are going to benefit from it, is being able to afford what they offer.
Now, I want to talk more about the med spa, but I kind of want to lay the foundation for what we're going to discuss today. Here in Texas, in Wortham, Texas, there is a med spa, and I back in 2023, and it's an instance in which someone at this med spa administered an IV that ultimately resulted in somebody dying. And now in 2025, the doctor that was associated with the med spa, the owner who is also the individual who injected the IV, both of them are under scrutiny. They have criminal allegations against them, civil liability against them. And so I kind of want to break down where things went wrong and why this was such an issue. Before we go into the nitty-gritty details with their names and all that, when you went through medical school and even into practice, med spas, were they a thing at all? Or is it something that is so very new that now we're trying to play catch up to the appropriate laws and the appropriate processes?
much newer I would say in the last 5 to 8 years that has exploded onto the scene. I'm sure there were a couple during my medical school, but absolutely nothing that we're taught in medical school, nothing that we strive to go and do. Most docs, I would say, do this as a side gig, something to make profit off of. You're getting cash pay, you're looking for a particular demographic of people who are willing to pay whatever it takes to have this feeling that they're doing more for their health.
And it's my understanding that, and you mentioned it, anybody can own a med spa, but in order to have the medical access that you have in a med spa, there needs to be some sort of medical professional, either an MD, DO. I'm sure in some states it might be an NP or PA, but you need to have somebody overseeing these processes and procedures.
Correct. Because you have certain medications and prescriptions that need to be ordered. It has to be ordered under a prescriber's name. That's usually an MD or DO, which means that anything that is ordered or done within that environment is under that physician's license. There are some states that will allow nurse practitioners to do that because half the states in the US do allow nurse practitioners to practice independently. I have not heard of anything in terms of a physician assistant. Again, all of them can open their own med spa, but as long as they have an license, then they can continue to prescribe what they need to or do what they need to in those med spas.
Okay, so it sounds like this is a side hustle for physicians and doctors if they choose to go that route.
Correct. And so far, everything has gone fairly well for most physicians. But as you had mentioned, this case brings it back to the forefront on whether or not it's worth taking these sort of risks. And then what sort of monitoring and supervision needs to be had and what sort of standards need to be had when you are collaborating or working with owner of a med spa and basically giving them full ownership of using your license in whatever fashion that they feel like they need to.
I have a few procedures that I want to ask you about, allow you to educate us on how they're used in at least a med spa environment. The first one, Botox and fillers.
That's usually facial enhancements. That's to get rid of crow's feet, wrinkles, lines, and then it also helps enhance certain aspects of your face, whether that's your chin, your cheekbones, your jawline. That's what fillers are meant to do. And so the combination of filler and Botox tends to help someone look a little bit younger or maybe highlight certain qualities on their faces.
Have you actually given any of your patients Botox?
No, technically you're supposed to go out and get some sort of certification for it. But again, there's not a restriction in who can get that certification. Personally, I would want someone that has a ton of anatomy knowledge, someone that has been through medical school, like a plastic surgeon, dermatologist. I would feel more comfortable with them doing Botox on my face because then they know exactly what types of muscles they're injecting, how it's going to affect certain things. And then the more important thing is what do they do when something goes wrong? Whereas some other medical professionals or other non-medical professionals who go through the course and learn how to just inject, yes, they know where certain muscles groups are at, but they have no idea what to do when something goes wrong.
No idea what to do when something goes wrong is paramount to the situation at hand. But to
Correct.
bring it back to Botox, I've never gotten Botox, but the one time I was offered Botox was actually by my dentist. And that was because I was grinding my teeth and I was having a lot of stress and pressure in my jaw. I guess they found a use for Botox as to putting it into the jaw, which would end up relaxing the muscles and would lessen the grinding. I chose to forego that. I just got a night guard instead that I wear. But it was pretty interesting to hear. You think of it as a cosmetic procedure to make you look better. I didn't realize at that point that there were other uses for Botox under that circumstance.
Absolutely. Botox is actually used for people who have really severe migraines. That helps relax some of the muscles around the scalp to decrease the migraines. It can also be used in bladder issues. So people who have a lot of incontinence, their bladder is not able to relax, then you can actually get Botox injections into your bladder itself. And in that way, it can help relax and not have an issue. So there are multiple medical uses for them, but in these med spas, we're not using it for those situations. We're using it specifically for cosmetic things.
Okay. What about laser treatments for hair removal, skin resurfacing?
Again, these are all cosmetic things. These are not necessary things. These are just things that patients want to do, whether that is hair removal, scar removal, if there is a scar and they want to lighten how the scar looks, or maybe maybe even pigmentations. If you have a history of acne or you've been exposed to sun a lot and you've got some darker spots, then these laser treatments help to lighten those areas and give you a more flawless or even look.
And what about chemical peels, which sounds extremely aggressive?
Same idea is that you're looking for that cosmetic beauty and you're peeling the top layer of the skin so that the bottom layer grows out and hopefully comes out fresh, new, more full.
Is that even safe?
If you know how to do it correctly, obviously, if you apply too much, apply too little, there's a lot of nuance in it, and that's why I personally wouldn't go to someone that has not had more medical training than just a weekend certification.
Based on those three alone, I would definitely want a licensed physician or, a nurse doing those things, somebody who has been trained in those, because all of those sound very aggressive. You're either sticking needles in your face, you're putting chemicals on your body. It's kind of insane what beauty costs this day and age. I'm going to move on over from the cosmetic to what is being called more wellness services. And you've mentioned a few of them. I have IV drips with vitamins, hormone therapy, and weight loss injections, which we've talked about weight loss injections with our GLP-1s. But as far as IV vitamin drips, tell me more about that, because the only time I've seen the IV vitamin drips marketed has been in Las Vegas, where after a long night, you can get an IV vitamin drip and bring your fluids up to par and not be hungover anymore. But as far as what you're looking at in a med spa, what's with the IV vitamin drip?
It's like supplements. There's no regulation behind them. There's no data supporting its benefits. I think in general, most patients who are eating a well-balanced diet of fruits, vegetables, protein between meats and vegetables, they are getting all the vitamins that they need. It's the people who have extra money that they want to spend to feel better. It's probably some placebo effects, but I would say over the span of the 5 or 6 years of me practicing, anytime and every time I've checked lab values when it comes to their vitamins, majority of patients are fairly at goal and where they need to be. But again, if someone's coming in and they're saying, "Hey, I'm fatigued," and the lab work looks normal, they're going to be still looking for answers. And so the answer is, unfortunately, these people who have opened med spas saying that this is your fix. This is going to be your answer because no one else has given them an answer.
Now, do IV drips actually help with hangovers?
Not in the sense that you think. The IV drips do not, the medications that are within the IV drips do not help with hangover, but it's the fact that you are flushing everything through more quickly. So guess what you can do otherwise is just drink a lot of water because it will also flush through your system and improve the hangover. But no, it does not improve a hangover in terms of the ingredients that are within the IV.
Okay. Okay. And then hormone therapy. I feel like hormone therapy is a big thing in this day and age, but tell me more about that.
That was actually quite controversial because there was some research data that came out saying that there was increased risk of certain heart, cardiac disease, certain risk factors, health issues, concerns if placed on hormone therapy inappropriately. That really pushed the medical field into not prescribing it as much. But as of recent, there's been a turn of the page where now there's new data coming out supporting that it is more safe than we realize and that it does help, especially people in menopause going through those postmenopausal symptoms, that it would benefit them in multiple ways. And there's still that conversation of what the risk could be and that it's individualistic and that you have to have that conversation with your physician. But the issue with the med spas taking it a step further is that they are giving it to everyone and anyone, whether they need it or not. They spout and say that it's going to give you energy, it's going to make you feel younger, it's going to make you feel healthier. But that's not always the case. They tend to be very expensive. They can be a hassle, whether you're getting injections, you're getting pellets. If it's something that you have to put topically on, it can spread to other people if you're not monitoring who touches that area. There are a lot of concerns. And again, we're talking about testosterone, we're talking about estrogen, progesterone. These are all things that in small amounts are probably safe. In the right patients, it's probably safe. But when it's overused, it can lead to higher risk of cancers, higher risk of cardiac issues.
The med spa almost reminds me of certain features of hims and hers that we discussed, where there's a doctor floating around somewhere. You're actively looking for something. You know what you're looking for, whether it's weight loss, whether it's hormone therapy, and you can go in and say, I want this. This is why I need it. You can manipulate the situation a little bit and ultimately get something that might not be good for your health.
This is a phenomenon that's mostly in the US. Of course, there's some med spas in other countries as well, but this is a big phenomenon where it's exploded like this in the US because of the prey that is the US citizen, where we're constantly looking to feel better, look better, all these things, these materialistic things. And we always want it quick now, and we don't want anyone to say no to us. Just like hims and hers, these compounded pharmacies online, getting access to patients to medications that otherwise wouldn't have access to. Med spas are doing the exact same thing. They're offering vitamins and promising herbs and things that may or may not be beneficial.
Okay. This is a good segue into the actual case that we're looking at. So back in 2023, there was a med spa in Wortham, Texas. And it was called the Lux Med Spa. The owner was Amber Johnson. She has this med spa, and with what she's doing in the med spa, she has to have the oversight of an MDDO, as you've already talked about. So Dr. Michael Patrick Gallagher, who was an anesthesiologist here in Texas, he served as the medical director of the med spa. With that, everything seemed above board.
Well, not really. The owner is not a medical personnel at all. She's
Right.
not a nurse. She's not even a medical assistant. Not an MDDO. Not an NPPA. So that is usually a pretty big red flag. Second red flag is you've got an anesthesiologist. Yes, they deal with a lot of medications when it comes to anesthesia, but how much do they know in terms of IV drips and certain peptides and all these other things that they're offering in the clinic? And then the third thing that I'm sure that you're going to bring up is that he actually never set foot into the actual clinic itself. He was just a medical director remotely and was just profiting off of whatever was coming in. And so those are all red flags for me in terms of looking at med spas. And you would be surprised, but most med spas function in that way is that you have someone on site. The medical director is usually nowhere near the actual physical location.
It's very impressive that you can call out these red flags with just the basic foundation, the base statement of who the players that were in what position before we even get into what happened. Because even as a lawyer, I would probably look at it and say, okay, somebody owned it. They had a doctor. That doctor is an anesthesiologist, so he's a specialist. He's putting needles in people all day long. He's monitoring vitals. Seems like they probably made a good choice going with him as their person. But you make a good counter argument as to, hey, these are all the reasons why he probably wasn't the best person for this, because his specialization in his realm is removed from what they're actually doing in this med spa.
And even if his specialization was within accordance to what was needed, he still wasn't there in person to help with anything. So the person putting in the actual IV, the person administering the medication is still not the physician or the medical director. It's actually this other person. In this situation, it was the owner who has no medical training, was the one that did the IV and then hung the IV and caused the death.
Yep. So in July of 2023, as you mentioned, a 47-year-old woman died after receiving the IV infusion there. As you also mentioned, Amber Johnson, who is the owner, was the person who administered that IV to this woman. And then again, the coup de grace is the fact that this doctor was not around. He was not there. He was not overseeing these procedures. He was not there to make an assessment. He was not there to help monitor. He was not there to recognize if something was to go wrong. Ultimately, here we are, 2023, this woman dies, and now in 2026, the doctor has turned himself in on multiple counts of criminal charges, including murder. Now it's starting to pick up 3 years later. Obviously, during the last 3 years, there have been things that have occurred with the medical board, with the med spa shutting down and civil liability. But it just goes back to have this point in time in which somebody overstepped, somebody didn't oversee, and somebody ultimately died.
Right. This is a great lesson to learn. Most things go well. Most cases go well in terms of the medical fields, med spas. You would say 80% of patients come in, have a good experience, everything goes well. But it's those small percentage, whether that's 10, 15, 20% of patients where things can go wrong, where you have to know some of the nuances. It's really important to have someone that has the highest level of education to be able to remedy and fix and troubleshoot the situation. And obviously in this scenario, that did not happen. But we see that across the country, not just in med spas, but in other areas of medicine where we have lesser trained clinicians doing things that we would expect a full-fledged MDDO physician to be doing. But because it's cheaper to hire them, it's cheaper to keep them on the team. We have these lesser trained clinicians doing things that potentially may be harmful to patients.
If you want to hear more about that, go back and watch some of our previous episodes. It's a good point that you make. And some of the notes from the investigations found that there were no proper medical protocols or procedures for the IV therapy. An unlicensed personnel was performing the treatment, obviously with Amber Johnson doing the IV, and then no licensed medical professional was on site during the treatment. Obviously, those were things that we touched on. And then when we're looking at the timeline, it looks as if the woman whose name was Jennifer Cleveland, she shows up, she gets her IV therapy, Amber Johnson gives the IV, and then shortly after the infusion starts, Miss Cleveland becomes unresponsive. She is not responding to anything, and Amber's sitting there, and again, this is just conjecture. I'm not sure what was going on in that room, but Amber, who is not a medical professional, is sitting there seeing this woman go unresponsive, and there's not a doctor on site. She called emergency services, and then the patient was ultimately transported to the hospital, and she died that same day.
And I read somewhere where the IV was the issue. I wasn't sure if it was like a TPN bag or the bag had a lot of potassium. And
Mhm.
so this person who was non-medical opened it completely wide open for the IV to flush through the body quickly. But if she had had any sort of medical knowledge or education, she would have known that potassium in high amounts can cause cardiac arrest, can cause heart issues, should not have opened it up that wide. And so from my understanding, that lack of knowledge is what sparked this whole situation. But then obviously when you're in the hospital and someone goes unconscious, someone's going to go in, evaluate, potentially do CPR if they're not getting a pulse. Does not sound like anything like that happened because again, there was a non-medical personnel who was administering and operating in med spa, not technically a medical clinic, but pretty damn close to a medical clinic.
It sounds like it'd be the equivalent of me sitting in the room with her and me not knowing what to do. So I'd just have to call 911 and hope for the best. In that situation, time definitely matters. Now, back to the potassium, because that was something I kind of, when I was looking into this case, is the fact that potassium and how much you're flushing through the system, as well as other vitamins and the danger, is that something that's common knowledge throughout medicine? Obviously, as an MDDO, physicians will know that. But are nurses also being trained on that? Are the NPs and PAs also have that same knowledge?
I'm sure they are being trained on it, but I don't know if there's a big emphasis on it.
Mhm.
If it's not something that they're dealing with every single day or thinking about, I'm sure that it wouldn't have crossed their mind. I can't paint it with a broad stroke, but potassium causing heart issues is fairly common knowledge. But then being able to piece together the rate of which it gets infused and whether or not it would be safe, that one tends to take a couple more levels of education to understand fully.
I asked that because when I'm in the ER or about to get surgery or hospital for whatever reason, usually the person giving me the IV is the nurse. And so when I'm looking at this and I'm saying, okay, like IV could actually cause death if it's not done appropriately, my mind goes to, are the nurses on the up and up about this? Like clearly they are. I just assume they've been trained appropriately to give me the IV or else they wouldn't be giving me the IV.
Remember, though, the difference is in a hospital setting, the nurses are taking orders from a physician. The physician has already given, you're giving this amount of potassium at this rate for this long. They are just simply following it. For nurses that are brand new, sometimes they may not know what the parameters are supposed to be. But a senior or veteran nurse absolutely would understand. "Look, the physician ordered this. Maybe they didn't mean to order it going that fast or that slow. They should see the pattern or the algorithm is not within their normal."
Okay. 'Cause sometimes it just seems like you go into like medical facility, it's a well-oiled machine and there people are just doing and there's not a lot of communication back and forth. They're just coming in, starting your IV drip. They'll come in, pull up a bag, plug something in, and you at that point you may not have even heard from the doctor, but it sounds like the doctor is still behind the scenes at every single point, basically saying, "Hey, I know this patient is here. This is what I want you to do. I'll come see the patient when I'm ready, but I need you to start this process for them right now."
You got it. Yep. The physician is ultimately the head of the ship, the leader of the team. Everything that goes wrong or goes right will fall back onto the physician. As we continue to discuss this, we see that this is yet another case where the physician takes the fall,
Yeah.
whether he's in the right or wrong.
Now, going back to safety measures, part of the investigation said that basic emergency protocols were missing or they were inadequate. and that med spas should have a variety of things available in case of an emergency. So three of the things that were noted, and not necessarily for this med spa, but just in general, were crash carts, emergency medications, and then obviously having protocols in place for something like a cardiac event. What is a crash cart, and what type of emergency medications do you think would be in a med spa to make sure that you're being safe?
Yeah, when you're giving medications that can potentially stop the heart, you basically want medications that can restart the heart. The crash cart tends to have what we call an AED, the thing that where you reshock your heart to reset that electrical system. There are medications like epinephrine that would be in the cart because that's part of the BLS and ACLS protocol, and that is basically the CPR algorithm. When you find someone that is down and they have no pulse, then you want to start BLS and ACLS, and then there's a protocol of what medications to give and how often and how frequent, so that you give the patient the best chance of coming back out of this with full function.
I assume that the more time that passes by, the worse it is for the patient that's going through the episode.
Correct. Especially if there's a decrease or a disruption in circulation from the heart to the rest of the body, that means there's not enough blood going up to the brain, not enough oxygen going up to the brain. That's why we always say if you find someone that's down, you can't feel a pulse, you're not feeling that heartbeat, you want to start chest compressions right away to just get blood flow up to the brain, because then you're going to save that person's brain function if they're able to come out of it.
It's so scary to think about because before this, I probably wouldn't even thought about a med spa in that capacity. If somebody said, "Hey, here's a $200 gift card to a med spa," I would go in, I would look at the menu, I would say, "All right, that seems like it would be good for me, whatever it is, whether it's IV or Botox or what have you." And I probably wouldn't even think a second thought about it. I would just assume that the business that is in place in most med spas, like I've seen them from the outside, they look glamorous, they look peaceful, they look expensive. I would just assume a place like that would have all the protocols and everything would be on the up and up. I wouldn't even think about having a doctor available and having all these emergency protocols available in case something went wrong.
We're in a capitalistic country, so
Mhm.
everything is catered to the people who are the most ignorant because they can sell the most to that person. A client that has no medical knowledge, they're going to make it seem very easy, simple, quick, because then they can get more money out of them. This is also probably why majority of physicians, majority of medical clinicians actually don't get these themselves. I don't think that there are that many, even though they're opening them up. I don't think many of them actually get the same treatments as they are offering.
Now, I want to pull in the legal, obviously, because and I want to ask you a question. I want to kind of test your legal knowledge. So, given this situation, we've talked about the players at hand. You have Amber Johnson, you have Dr. and then you have the med spa, and then you obviously probably have other employees that work there. Who are you suing from a civil perspective?
You're suing everyone.
You're suing everybody. I love it. Your answer is completely right. From a civil liability standpoint, you have medical malpractice issue here. You have a wrongful death situation here. One thing that is to be considered is the fact that obviously you can sue the doctor, Dr. Gallagher, because he was supposed to oversee this. You can sue the person administering it, but you could also sue the entity itself, which is the med spa, which is the business. So although Amber Johnson was the owner, but also the administrator of the IV, you can sue both her business and her in two separate realms. Amber, as an individual, may not have a lot of money. All of her money can be rolled up into her business, which is probably protected as a corporation or LLC. And so that's why you'd also sue the business and go after the business in that capacity. So, from a civil perspective, it looks like there is a lot of liability that exists with all the players in this situation. And I would also be curious to see along the line who else was involved. Did you have a hostess? Did you have somebody who checked you in? Did you have somebody that was an office manager? So your point of suing everybody else outside of the one entity and the two individuals, I wonder if there'd be anybody else to sue in that setting.
I want to point out again that the physician was not in-house, never stepped foot into this building, but they're still held liable. That is a great example of how it bleeds into actual healthcare in general. And we've talked about in other episodes where nurse practitioners and physician assistants work under a physician license. And so whether they're in-house or not, that physician license is on the hook if anything goes wrong. The liability falls onto the one that has the biggest pockets. And so it's usually the physician. But right now out there, so many people, because majority of the time things go well. Don't think about those situations until something bad like this happens.
Exactly. Good that you brought that up because when we're looking at the criminal liability, Dr. Gallagher here is probably the one who is possibly going to see the most jail time. Now, granted, he just turned himself in and he faces these charges. Currently, they're just allegations. Got to go through his day in court. But as of right now, the legal theory, at least from a criminal perspective, is that he had a legal duty to supervise medical care and he failed in that duty in a way that led to death. Talking about the standards, you've talked about the standard of a medical provider, a physician before, and the liability that exists. He didn't hold up his side of the bargain. And so currently in Texas, he could face murder or manslaughter charges because his actions were reckless and they caused death. He could also face criminally negligent homicide, which is a little bit lower. It's not as serious as a murder or manslaughter charge, but it basically he failed to perceive a substantial risk, and that substantial risk was him not being in the office. I think that if he had shown up and supervised, this may have been a life-saving event rather than a life-ending event.
It just makes me think, was it worth it? How much did you make off of it? Maybe a couple thousand a month extra for this spa to use your license. It really gives me pause for all those physicians out there willing to do anything to sell their license just to make a couple of bucks. It's concerning.
We get philosophical here. Do you think that this is because of the pressure that's put on our physicians to pay off debt, continue to make money, lifestyles that they're trying to achieve? Do you think it's just trying to be a medical mogul and having your hand in a lot of different experiences? What do you think kind of influences somebody in that manner to say, I'll put my license at risk. Let me just go ahead and do this, even though I spent decade plus trying to get through school and residency, and then I've spent all this time practicing. I'll risk it all for a med spa.
Yeah. Multifactorial. Everything you've said already, the need for more money, whether that's the lifestyle inflation that they have and they want to continue to fund that lifestyle, whether it's student debt that they're paying off, whether it's a mortgage they're trying to pay off, any sort of debt that they're trying to pay off. It's a lot of pressure. The other thing is just looking for easier ways to make money. They think that, hey, I'm going to be an entrepreneur. If I can open up 6 different med spas and not be there in person, that's going to be the easiest money that I make. Doctors fall into that mindset too easily because we've worked so hard to get where we're at. Sometimes we just want to find an easy way out. And again, 80-90% of the time, it goes well. It goes very easily. But it's those very small percentage of cases that then can completely uproot your life and flip it over on its head.
Well, Long, as far as med spa goes, would you recommend med spas? Would you want patients going to med spas, or do you think that there's more research that needs to be done? You're a very fair assessor of things like this, and you kind of tell it like it is. And if you see value in something, you'll definitely let us know that there's value in it. But what's your overall opinion and assessment? Again, not medical advice, just a doctor's opinion.
Not worth it. If you got extra money that you want to just throw and pee out more expensive urine, go ahead and go to the med spa and get the treatments. But for the average patient or average person out there who cannot afford it, it's not worth it and it's not needed. You can go to your family doc, have a discussion about your issues, complaints, do a full workup that's covered by your insurance, and then get treatments that is covered by your insurance that is also backed by evidence and science over the years. I know some people are going to bring up the pharmacologic entity that may be in the ears of the doctors, but honestly, we do not get any sort of kickback by recommending certain prescriptions or prescribing certain medications. And so at the end of the day, we are trying to help patients. So if you feel like you're missing something and you feel like something needs more in your life, let us know. But if you're eating well, you're exercising, you don't need the med spa.
People are just trying to live forever. That's what we're trying to do.
What do they call it? It's like life maxing or something. Is it Brian Johnson or something who is trying to outlive everyone? He's like a billionaire and he's just spending all his money and trying to live longer.
Is he the one who like pumps his son's blood through his
Got it.
body to try to get the younger, I guess, fuel for his body?
That's the guy, but he doesn't even look good. I don't know if you've seen his podcasts or videos. Whatever he's done to himself, you can tell something's been done to him. He does not look young. He does not look healthy. He actually looks sick.
It almost reminds me of like what I would envision a vampire who's trying not to look like a vampire to look like.
Yep, you got it.
Well, Long, I definitely appreciate your insight on this. I think I will go ahead and I will avoid med spas for the time being. I'll stick to just, the regular old day spa. But thanks everybody for tuning in. This has been another episode of the Medico-Legal Brief, where medicine meets the law. If you haven't already, go follow, like, and subscribe. YouTube, Spotify, and then look us up on all the social medias, TikTok, Instagram, we even are on LinkedIn. We have these episodes every Wednesday at 10 a.m. Tune in and engage with us. We love engaging with our followers. We love engaging with comments. It's probably one of the best part of our days when we get a good comment and a good back and forth. Really appreciate it, and look out for us online. Yes, we're doctors. Yes, we're lawyers. No, this podcast is not medical or legal advice. Do not take anything we say as a reason to perform your own heart surgery, represent yourself in court, or diagnose your neighbor's rash. This is for entertainment only. Think of it like hanging out with your smartest, wittiest friends, not a substitute for an actual appointment. If you act on anything we say without talking to your own professional, that's on you. Seriously, don't do that.